Hello, everyone, and welcome to the third session of the Let's Talk About Alternative Methodologies series. This session focuses on exploring California's experience collecting childcare cost data. My name is Heather Madison, and I am from the National Center on Subsidy, Innovation, and Accountability. We are happy to bring this series to you in collaboration with the Office of Childcare and the National Center on Early Childhood Quality Assurance. Our presenters and guests will introduce themselves soon, but first, a few housekeeping items. The call is being recorded and will be made available to anyone who is not able to participate today. As participants, you are able to turn on your video and unmute yourself. We ask you that you remain on mute and use the chat to ask questions and make comments. We will be collecting questions and answering them throughout the webinar. If you are not able to use chat to ask a question, we will have opportunities for you to come off mute to ask your question. If you require technical assistance during the webinar, you can contact Beth Holmes through chat or email her at bholmes@wrma.com. You can turn on closed captioning at any point to assist you. This is the third in an ongoing series of conversations about cost-based alternative methodologies and childcare cost data. We hope this series will help support you in your work. In the second webinar, we spoke about how to strengthen your use of cost data for race setting. That session recording will be available soon. We will continue to improve this series to ensure it meets your needs. At the conclusion of the webinar, you will receive a link for an evaluation, and we encourage you to complete the evaluation to let us know what worked and what can be improved, along with any questions and topics you would like us to explore through this series. And now I'm going to turn this over to Nina Johnson, who's going to do some introductions.
I'm Nina Johnson with the National Center on Early Childhood Quality Assurance, and I'm really excited about the group of people who are joining us today from California. I'll start by saying that Lupe Jaime Mileham with the California Child Care and Development Division, their deputy director, she will try to make the call today, but got called into a meeting, so she may not be able to make it. But we have a wonderful team here from California. Adam Lara, Anna Levine, Becky Halligan, all with the California Child Care and Development Division have joined us to share about the work on cost modeling in California and gathering cost data. And Gina Capito with Prenatal Defy Fiscal Strategies. So you'll hear from each of them as we talk today and learn together. And then we'll just go briefly over our agenda. So really, this call is centered around learning from California. And we wanted to focus on this because we know that you all are in the process of thinking about how to gather cost data, or maybe are in the process of gathering cost data. And so it's really helpful to hear from a state about their experiences. And we want you to have opportunities to ask California questions. So as Heather said, please put your questions in the chat. We're going to structure this call around 4 different sections that you see here. And we'll pause at the end of each section to get to your questions. So first we'll learn about California's childcare landscape. Then we'll hear about their experience with data collection, with engagement, and then we'll talk with them about how they actually modeled the child care cost. And our objective for today's call is really simple. We want you to have concrete strategies to collect child care cost data that are based on California's experience. So we understand this is just one state, but we think that you'll have a lot to learn from them, and we're excited for you to be able to engage with them. And Heather, I'll turn it back over to you.
Great, thanks, Tina. So we're going to jump right into questions for California. And as we go, we might have some visuals to show you. But most of this will be a conversation. And as Nina said, jump into the chat, ask some questions. We're going to try to pause throughout to make sure to look for those questions. So I'm going to dive right in, and we're going to spend a little bit of time just learning about California. So my first question is, can you tell us about California, Anna or Anybody else from California? What are the childcare and family demographics, the childcare needs, and what does childcare look like in California?
Hi, good morning. I'll start with that. I'm Anna Levine. I am, as said, the branch chief in the Child Care Development Division, and we're delighted to be here. I think the main thing that we always start with in talking about California, people who are only sort of generally familiar with it, is what you probably understand vaguely, which is we are enormous and quite diverse. That's in our demographics and in our childcare landscape. There are roughly 6.8 million children ages 0 to 13 in California. We're a state of about 40 million people, and about 2.7 million who are ages 0 to 5. And our families, a little less than a half identify as Latinx, about a quarter as white, about 12% is Asian, 6% is African American or Black, and 4% is multiracial. And almost half of California children, 47%, live with foreign-born parents. So when we're looking at our state, we're looking in data about our state. The sort of the subcategories within those groups, you have people in the state is also very, very geographically. So you have the inland areas, which tend to be have higher concentrations of poverty, and where there's a lot of growth in our young families. And we have, rural and mountainous old lumbering regions. We have enormous cities. We have enormous counties. There's a little of everything. There are a little fewer than a million spaces in licensed childcare programs. About 688,000 spaces in center-based programs, and 267,902 in spaces in about 25,000 family childcare homes. So put another way, there are about 10,500 center-based programs, about 25,000 family childcare homes, and about 1 million spaces total in those. And then we have, and I'm going to get the numbers wrong. Adam would probably be able to correct me, but in terms of our subsidized childcare programs, we make substantial use of family friend and neighbor license exempt care. I need to catch you off the spot. Do you remember offhand, Adam, what our numbers are in family friend and neighbor?
I think last time I recall, we're about 19,000 providers.
Yeah, and they serve. Oh, I'm sorry. Go ahead. I was going to say they serve a very particular role, or they particularly serve our families, as they do in many places, who require non-traditional hours and who are stabilizing in our early in our TANF, our CalWORKs system, and also to some extent our some of our child welfare providers. So we have funded enrollment for roughly 290,000 children. So like everywhere, we don't meet the need, but by a very long stretch of the imagination. Those 290,000 children, that's in voucher-based programs. So we have both voucher-based programs. Like a lot of states, we do have very long-standing use of contracted. Mm-hmm. What are called family childcare home education networks. And then we have alternative payment programs, which is what we call the sort of voucher paying programs that we contract with to provide vouchers for children to attend private pay centers, family childcare homes, and family friend and neighbor care. So about 290,000 kids are in those voucher programs. About 87,000 are funded, I should say, for the direct contract and migrant programs. Those are numbers that are derived from what we fund divided by what we conceive of as a slot, which is a terrible term because I find it very dehumanizing, but that's how we think of it, as like a seat in the classroom or with a family friend and neighbor provider. So that changes sometimes those demographics. So we administer about $7 billion in funding to operate these programs. About 2.6 billion of that is federal, and then the remainder is state. So we have very substantial state investments in our programs, and that has also been true for a very long time. We have that dates all the way back to early. I don't want to get into too much history, but into early progressive era and into the World War II era, when we had federal funding and then replaced it with state funding in our sort of our military related Lanham Act centers. And then the federal Head Start program separately funds enrollment for about 89,000 children, including 125 in tribal Head Start. We have the largest, I believe, tribal population in the United States. Some of those are federally recognized tribes, and some of them are not federally recognized tribes. So I think large and diverse is, again, the key word. We also, just to make matters more complicated, we administer our childcare programs through two different departments. This is the Department of Social Services, are the childcare lead agency for childcare and development funds, and we administer those programs. The Department of Education separately administers a state, non-federally funded state preschool program for 3 and 4-year-olds, and also what effectively is a grade level, a kindergarten grade level called transitional kindergarten, but that serves also some children who are turning 4 and are 4 and 5-year-olds. So if anyone's not overwhelmed with that information already, we have, and we fund, because of that complicated patchwork of programs, we have this patchwork of rates and funding streams. So we have a flat standard reimbursement rate that covers the direct contracted slots, those seats in classroom programs, and it has no regional variation, but has multipliers for different kinds of specific circumstances, like children with IEPs, IFSPs, with disabilities, and who are called children with exceptional needs, which is not a term I chose, and for language learners, multi-language learners, a couple other things. And then we have a regionalized regional market rate, which is for our voucher-based programs, and for some family childcare home education networks, and that is based on the regional market rate survey. And so that is the option we have historically chosen, and that to some extent guides, though not entirely, our standard reimbursement rate that we set in the budget for our direct contract programs. But it's that a long-standing recognized big mess, the funding stream. You have to have almost like a PhD in California funding to understand, and for our providers in field and for everyone, it's not an easy answer, like what will you get paid if you provide care for this child? And that is a long recognized historic problem. But the last thing I would leave in this question sort of response to it is to recognize this is an enormous priority. Both rate reform and investing in childcare are huge priorities for the current administration. And we've continue to make historic investments in childcare, which are reflected in the numbers I just stated about state investments. In this year's budget, for example, 2023 to 2024, we're on a July 1st, like a lot of states, to June 30th schedule. So not the federal October 1st to September 30th schedule. We allocated, among other significant items, $85.4 million to eliminate co-payments, what we call family fees, for families along the lines of the Build Back Better plan who have less than 75% SMI, and to reduce it to 1% for income between 75% and our exit income of 85, the federal exit income of 85% SMI. And $2.8 billion for reimbursements to preschool and childcare development programs, providers for payments to increase their payment. It's in the form of stipends, a sort of lump sum and monthly stipends, but to increase the reimbursement that they receive with the expectation and understanding that when you increase reimbursement, you're increasing pay within programs, because that is where the money is needed and goes. And so that's pending legislative approval of a union ratified union agreement, which is the other thing I could mention is California has a child care providers union, but it only covers family child care and family friend and neighbor, not centers. But and it has existed since 2021, but in both the original agreement and the one that we just entered, there's a very strong impulse to create parity with our center programs because they're important, very important to us. And so, those union agreements tend to guide, and they have again in our budget investments this year. And as I just covered, it's a mixed childcare delivery system, and I would emphasize that we're really committed to that. I mean, we need our family friend and neighbor care. It serves a very important role. We need our centers and we need our family child care providers. They all have both from a parent choice perspective, from an equal access perspective, just making sure, because we need space and capacity, and from recognition that as a large and varied state, there's no one size fits all solution in terms of childcare settings and what we're providing. Different things will meet different needs. So
great, thank you. That was a lot. Wow, you guys have a lot going on. You just have to take a breath just on everything you have going on. The diversity of California is very impressive in some ways, but must be a challenge. And I'm curious about equity and how, I know that's a priority area, and you mentioned that. And so how do you define equity, and how are you thinking about equity when it comes to childcare?
We think about it an awful lot, is where I would start. Both because it's an enormous priority, and in some place where we recognize our failings, like everyone, that there are significant historic and systemic inequities in our system. We have a system in which, like most places, our childcare workforce is, almost entirely women, and vastly disproportionately women of color, and is historically just tremendously underpaid because of a legacy of racism, among other things. And that's been recognized in federal research and state research. Every time we looked into this, we ended the same place. And in terms of access to good quality, affordable options for care, that also does not exist equally across our state in a variety of ways. And when you have a large state too, you have to think about equity, because again, this is the problem of our standard reimbursement rate. If you have one thing across the whole state, it's going to be inequitable because the state is so varied. I live in Oakland, California, and within my public school system, I know we have over 1,000 children who are homeless, and we also have billionaires, right? That's California. So you have to think about equity and start with it and center it. So we've defined it. Like a lot of people, you have to start by defining it. And in our rate reform efforts, we have defined it as a process and an outcome. So as a process, it means that children and families who are most impacted by historical inequity are meaningfully involved in the creation and implementation of policies and practices that can address it. That's sort of the nothing about us without us. Like they have to be involved so that we make sure that we're making choices that address their needs. And that includes rate setting informed by the cost model. And it means, we need an inclusive process with robust engagement. We need to think about and specifically call out and address historical racism and inequity, because it's here, and in order to disrupt it, and promote the promotion of cultural and language affirmation, and we use a targeted universalism approach, which there's information sort of explains that or describes it at Berkeley's website. I can never keep track of the name of their centers anymore. Which one developed that particular tool? But the short version of targeted universalism is that we set goals for our children and families of what we hope to achieve with our programs and for them, and for all of us. And then we recognize that means that you specifically target particular areas, groups, settings in order to reach those goals. And to identify and serve children and families furthest from opportunity. We have an executive order from Governor Newsom that we specifically operate under that requires us as a state agency to embed equity analysis and considerations in our mission, policies, and practices, and specifically requires in data analysis. So that's been something that we have borne in mind and know that our P5 working with us is very aware of, that when we're looking at that data and equity are closely combined. We're looking at costs. We have to think about that. And so we've been working with P5 and using the Rate and Quality Advisory Panel, which is something we can talk about, and the union as sort of guideposts and input to ensure inclusive public engagement and uplifting community voices, and particularly reaching out to historically marginalized communities to advise our data collection and analysis and rate setting efforts. And that, I think I talked about equity as an outcome a little with targeted universalism, but simply put, it's equity as an outcome means in terms of metrics that rates will be targeted based on the cost model, so that personal characteristics outside of a child or family's control, such as race, national origin, gender, ability, status, religion, do not statistically predict how they fare. That is our goal. That's what we aim for. And so our hope is to work with the cost model and our use of it to develop proposals to address equity in our rate setting.
Wow, that's a very lofty goal. So that's great. Nina, are there any questions in the chat or the Q&A that we want to address?
There was one question that Adam responded to about tracking non-licensed family friend and neighbor care. So I think people can just refer to his response in the chat.
Great.
And then Anna, I was going to just summarize how you defined equity as a process and an outcome in the chat, and then you can correct it if it's inaccurate. I think we can move on to the next section.
Great, thanks, Nina. We are going to move to data gathering and those questions. So just to start, I think you did address one of my questions was, what questions do you have? So it does sound like you have a very lofty goal around using your data to create a cost model that hopefully will create an equitable rate system, at least. Do you have any other questions about what you're going to find in the data, or that you want your data to answer as you're moving forward in collecting cost data?
Yeah, we're significantly guided here by what we need to do. I think that the ACF's guidance around the alternative methodology is very helpful in sort of thinking about what kinds of questions we need to answer. And so I'm actually going to turn this one over to Becky, who is our point person on all things state plan and ACF within our policy department, to talk about sort of what kinds of things we're looking at and keep on sort of checking mentally when we're looking at questions to answer with our data.
Great, thanks.
Yes, thanks, Anna. I'm Becky Halligan, and I am a child development consultant in our policy office. And as many of you probably know, if you're considering the alternative methodology, that there's a pre-approval process. And in that pre-approval process, you are asked to answer 10 or 11 particular questions. And it was through going through that process that we were able to hone in more on the data that we needed, just based on me answering those questions. For example, some of the things that are flagged are the variation in the prices or costs, relevant dimensions such as the provider types and the level of provider quality and the child's age, geographic location. So our data will be informed by those things, right? Mm-hmm. Also, what is available in our programs that provide care for those that are in non-standard hours, mm-hmm. those that offer transportation, those that give family support services, all these things, providing care to children with special needs, dual language, all of those types of data points were addressed in our responses to the questions. And those responses went through a rigorous back and forth with ACF, which was really helpful. And we say to you, as having just completed that and receiving our approval, that that process works to help to narrow down where the data points should be. So, Anna, did you want to add anything to that?
No, I think that's right. So it's this combination of, what are our goals as a state in terms of just sort of general policy goals of identifying where we're farthest from meeting the needs, mm-hmm. And then using that guide as Becky said, add it, succinctly of the ACF process to think about like what kinds of specific questions do we need to answer, which helps us sort of think about categories of things like where we're going to have to hone in for more information and work with P5 to hone in for more information.
And a lot of times we talk about using data to figure out the true cost of care, but we want to look at also the barriers. Mm-hmm. What are the barriers to the costs? So what prevents our programs from really meeting the needs of mm-hmm. The children and families that they serve? Mm-hmm. So that has to be considered too.
Great. Okay. So my next question is for Gina. And Gina, I know you work with California, as Anna mentioned, as the researcher working to collect this cost data and to move towards their alternative methodology. Can you tell us a little bit about how you advise states on their approach to cost data collection?
Yeah. Hi, everyone. Thanks, Heather. So I'm going to pick up right where Becky was with the pre-approval letter, the details on what's required to meet the federal regulations to do alternative methodology are critical to the process. We do always want to work around the idea of what states are also the individual context and what they want to understand about the implementation of services and how that is of critical importance to the work of rate setting, right? Because the data collection and the process are all to inform and support the rate setting process. So we want to be thinking with that long game in mind, but of course we have to go through the steps in the process of alternative methodology and think how the data collection supports to meet the expectations of alternative methodology. And part of what we do with the advising states on data collection is hold the whole, like start back with what the whole process is and then think about what the process is seeking to achieve. So I'm going to share just a couple quick slides with the group just to illustrate some of the concepts, and then we'll come back off screen sharing. So we're not going into lecture mode by any means, I promise. Still discussion style, but I think that it'll help a little bit to see some of it laid out. As Becky said, for states that are in a place of thinking about this right now and kind of really getting very tactical and hands-on, seeing some elements of it, I think can be helpful. So we start with sort of the basics of the alternative methodology, the steps in the process. And we start with this when we advise on the data, because the data collection is about constituent engagement. And I know we've spoken about equity already. We're thinking about engagement of many individuals in the process, and it has to be a value that's part of the whole process. It can't be a sort of, when we get to data collection, then we'll start engaging with people in understanding how we get good data from programs and providers. So that's a kind of a core value of it. The other big piece that we want to try and reinforce is that in states like California and Virginia, New Mexico, and District of Columbia, who have all now used alternative methodology for their rate setting, those are states that did a cost study combined with a cost model. And so that's an important piece of thinking about data collection as part of the process, not the end of the process, right? And so that there's a big difference between thinking about a cost study where you gather data and that's that point in time sort of understanding of cost. That is one piece of this particular approach to alternative methodology, but it is not the only piece of the approach. There's then the building of a cost model, the actual tool, which is going to use some of that data and rely on the analysis and the outcomes of some of what the data is telling us, but it also has the opportunity to pull in lots of other extant data sources. So that's another big piece of sort of thinking about data collection as not just that one time or one element of data collection of going to providers and programs, but also thinking about the other data that's sort of available in your universe that will support having a dynamic tool that then the state can use to understand cost, support them in making some rate setting choices and decisions, and then informing their overall policy. So we kind of try to think about this like big picture as we advise states, because we want them to sort of hold on to the whole. I know that we're going to go into more detail on like the how of data collection, so I don't necessarily want to take us quite there yet, but I did think it was helpful to share also then another piece that, given again, states may be in a position of thinking about moving from a market rate approach to alternative methodology or a cost-based approach, and sort of understanding data a little bit differently. So there's a few things going on this particular graphic, but if we just sort of focus on the idea of data sources, this also helps with that thinking about how we approach data collection. In a market rate-based approach for rate setting, the market rate survey is the one tool that is informing the market rate approach. In a cost-based or alternative methodology approach, there are multiple data sources coming into play and being used differently throughout the approach. And so that bottom blue box sort of highlights there's primary data collection, things like a survey, talking directly with programs and providers through input sessions and interviews, but then there's secondary or extant data. States may have other data available, especially coming off of lots of different implementation of ARPA funds and ways that states have surveyed providers during that process. There are other extant sources like Bureau of Labor Statistics, living wage calculators like the self-sufficiency standard or the MIT living wage calculator. So there's a lot of different elements of data sources to be considered in the cost-based approach. And so it's important to think about that when we then think about the primary data collection. How do we go about what is uniquely going to be heard from programs and providers in a state? Because there's other things that we can get from extant sources. So how do we make sure that we are sort of using everybody really well within the process and not burdening providers, not having them be the ones to tell us like, well, what should the living wage be? We actually have calculators for that. We have extant sources, but there's things that are very unique to what providers' experience of delivering care, and those barriers, as Becky mentioned, we can only hear that from them. So we want to make sure that we right size that approach to the data collection. So I'm going to pause there in the screen sharing. Just wanted to highlight a couple of those concepts and how we talk about it with states.
Gina, I have just a quick follow-up question. So it sounds like you're recommending starting with the extant data sources that you have, and then supplementing with data from providers where you don't have enough data from these other sources. So number one, is that what you're saying? And then number two, would you recommend that providers review the data that you have pulled from extant sources?
I have to say to that first question, Nina,
Mhm.
I would not say that I'm recommending that we can start with extant. We have not found a
Mhm.
state yet across the work, and we are working with several other states in addition to California right now that have data that is current enough and sort of exactly in the spirit of current cost operations, kind of basic operations of their program that can fill the needs to build a cost model and the needs were laid out in alternative methodology. We have not found that. So you do have to plan for the primary data collection, but then there's the possibility that there's some extant sources like other California, for instance, has a great workforce survey. That survey has been very informative around the composition, the sort of demographics of providers, the family composition. That's really useful to understand. Are we talking about lots of individuals that are single, no kids, or lots of individuals that have multiple children and their costs to live as a workforce are different if they have multiple children and say they're a single parent? That extant source can be really useful. The workforce survey doesn't replace the answers that we have to get from that primary data collection. So it's a little bit more of the balancing act of how they have different roles in helping to begin to inform assumptions in how the cost model operates.
And I also have a follow-up question, which is, in that other data, is that one of the ways, and this kind of piggyback, so I'll give you both questions. One is just a question around big picture, how do you collect data? And then, but the second one really is about those extant data sources, how you think about potential future costs, right? Sometimes when you're gathering that information from the providers themselves, they can report what their current costs are, but may struggle with what could potentially be. So how do you collect data in a big picture, but then how do you think about collecting data or using data sources to project what you want the field to potentially do, such as wages or other quality measures?
That's a great way to think about potentially the buckets that the sources could fall into. There's no question that primary data collection with providers, even if you ask them what more do you need to pay, what types of benefits do you need to offer, those answers are very much informed by their current reality of revenue and their current circumstances, frankly, many years of scarcity. So they do things like say $1 more an hour. We know that $1 more an hour is not going to attract and retain our workforce, right? Like we know this for years and years of doing this. So it's not necessarily a fair question for providers to be the only source of sort of thinking about where you're headed as a field. So that is a good way to think about that. Many of the extant sources, like the MIT living wage calculator or the self-sufficiency standard work, those provide examples of what people need today to live, but when we think about changing a whole system, we know that it could take time to get to a place where you're paying at a percentage of a rate informed by those salaries that actually is going to be sort of in the hands of providers. To what Anna said about like the rate needs to go directly to compensation, but any increase in rate, it's going to take some time because we're talking about a pretty major shift. But there is a significant role for the current cost, understanding the current cost, talking about a living wage driven cost of care. You often have folks sort of not understand that the cost now is higher than what revenue is paying. And that if that is with wages that aren't meeting what people need to live in their communities, right? Some of those things that we know exist, if we leap over that and we just go to a living wage, you can lose folks and they don't understand sort of the current reality. Even if we didn't pay a living wage, we need to be compensating more than we are. We need to have rates that are set at a higher point because we are failing based on using a market rate. Like that's part of what that story tells. And it helps states to see that story, to have the current cost, to understand sort of, well, where is the current cost related to the market rate and where is true cost, right? To have those pieces of information becomes really important. So that's one key piece of that idea of sort of what role do different data sources have? And then it also starts to depend. It depends on the data sources. I gave the example of the workforce study in California, helping us by informing us around the family demographics, the family composition of the childcare workforce in the state of California, which is really important to understand what living wage needs to be for a given individual, right? So it's like that extant data source fills a different role within the system and could fill other roles as the workforce study continues sort of to be used. So I went to your second question before your first question. Now I'm going to go back to the first question on then how do we go about, because in particular, I want to talk about this idea of how primary data collection has occurred thus far in the approach that Prenatal to 5 fiscal strategies uses to alternative methodology. And I do have a slide for this too.
Great.
It's a lot of complex details, so I think it's a little more helpful to kind of see it in one place. This is actually a sample of a slide that is used. Californians will say, it looks a little familiar, because a version of this has been used within the state of California to explain the program provider data collection, to sort of put that primary data collection out there to folks and sort of understand. So we do use a survey. We do use input sessions and interviews, which the input sessions are basically small group discussions. I'll talk a little bit about how those two things are different yet complementary. And then we do, to Nina's earlier question, try to leverage any other data collection efforts that are underway. We have worked with states where, as part of the process, they've said, well, why don't we embed some cost questions in our market rate survey? Because we're still going to do our market rate survey and move to cost. That's a great idea, right? There's no reason not to embed some questions, as long as we're not going to be burdening providers where the surveys become so long that they become onerous for a provider. So we do look for if there's any other points of data collection that we can sort of like hop on with, or if something just happened that some of the information can be leveraged in. So this one sort of is like a primary data collection, but it starts to drift that last item to, is there an extant source that we should also be pulling in? It's very contextual. But to speak about those two big items, the survey and the input session or interviews, the nature of the survey is to focus really on the quantitative cost drivers, the expense experience that programs are currently operating under. We do focus on primarily some of the biggest cost drivers. Most states do want the option of a non-personnel component to the survey that providers can answer if they want to. We do try to make that optional, because it can take a lot of time for someone to tell us all their non-personnel lines, and those often are about maybe 5 to 7% of the budget of a program, not the 70 to 80% that compensation is. So in the spirit of trying to think about how do we not burden providers, that's a way to think, like, let's make sure that we're not having them give us line by line every single thing in their budget, when we know things like we can put a cost per child on the educational materials that most programs experience. You know, we know that from lots and lots of other work across the country. And other tools like the provider cost to quality calculator has some of those standard amounts per child. So there's lots of sources for things like that. But this is their opportunity in the survey to really give that quantitative that's specific to their program, right, and answer those questions. The complementary use of the input sessions or the discussions gets at more of the qualitative. What are your barriers to delivering care? What are your barriers to delivering higher quality care, meeting the standards or regulations? We are obviously trying to get at costs related barriers. It pretty much always goes there, even if we don't ask directly, tell us about where the cost driver is in that barrier. But that's where we hear things like attracting staff, retaining them once we hire them, right? That we start to hear. This is our opportunity to start to understand, in delivering care to different type populations of children and families, what are some of the expenses or challenges or barriers you encounter? What are some of those in the sense of cost drivers? How do they play out? So that we kind of get into the more of the qualitative, but we're listening for things that are cost drivers and things that are going to need to inform the cost model. As we think about analyzing the data, we want to understand for different populations of children and families, the care can have different costs, right? And we know it has different costs for different ages of children, but there's also different circumstances that children can be presenting with that can have a significant cost to providing the service. And so we want to understand from programs or providers. So that sort of more qualitative discussion happens during the input sessions, and then the two things complement each other, coming together around their current experience. We also frequently hear during the discussion about what they need to be providing. But I need to be able to offer health insurance and I'm not, or I used to do this and I had to drop it from my operations when the balance between my revenue and my expenses became further and further out of whack. So we do learn a lot about their operations that speaks to that idea of they need more staffing than they are currently able to support. So there are definitely things that support us in what we might want to call the future, but actually the reality of like what their staffing pattern has to be to continue to do the program and to make it so that people aren't working 60, 70, 80 hours a week, which is what we hear a lot during the qualitative too, how many hours they actually work to deliver the program. Times that the children are in their facilities or their homes. So I think I'll pause there and see if there's next question and stop screen sharing again. See if there's any follow-up questions.
I have a follow-up. I appreciate that you said that the non-personnel costs are not a high priority, that they could be optional in the survey for providers. But I do wonder if you'd prioritize like rent or mortgage or lease, since that can be a high non-personnel cost.
Yeah, we do. We pull out occupancy, so it includes sort of everything related to occupancy, right? Because there can be some pretty high ticket items around gas and utilities, snow removal in some parts, right? So we pull out a couple of the highest ticket item non-personnel, and we do call those out on the survey. We don't make those optional for that very reason. Okay. That's been our experience.
Right. Thanks. And I also have a question around, I know this is a question we receive a lot through the Technical Assistance Center, is how do you ensure that the data is representative of the childcare community?
So I'll start, and then California, Anna and team, I'd welcome you to hop in on how we've been thinking about that as well. We do a lot of educating, talking to the different constituents in the space, really trying to prompt with questions around, you've done market rate surveys before, you've done other surveys with your childcare communities. Where are you seeing the low representation? Where are you not hearing from people, and especially compared to licensed capacity that is utilizing subsidy to serve families, right? So we do some prompting what pattern have you seen? How do we ensure that we sort of get to everyone? The other piece of the education comes in on saying that it is about everyone, right? That the market rate seems to strike people as, yes, everybody can answer the question of what rates they charge for childcare, right? If you're going to thinking about a cost survey and it's about for the purpose of informing rate setting, you do have times where folks say, well, that's only for programs that take subsidy. And so we do a lot of education around the idea that it's actually not, because there may be programs that don't take subsidy, in part because the system doesn't meet their needs for revenue. And if they were part of helping inform the rate setting, that dynamic might change. So we really try to impress that it is for all providers, and then find the channels to get to all providers, right? So that it's not just the partners, whether it's county-based entities, the training centers, the things that providers have access to that maybe are coming because they're part of the subsidy system. How do we engage with the partners that are not just because they're part of the subsidy system, right? So really kind of casting a very wide net in how we make the approach.
I'm wondering, I think you alluded to this, Gina, but this question is for you and for California. There are, I'm sure, populations that tend to have lower risk rates within the state. And I wonder what you've done to think about more intentionally reaching out to them to be sure that they're included and that their response rates are increased a little bit.
Yeah, I mean, that's definitely something that we do a lot. I would say, in addition to, which goes back to something Gina said, sort of there's a comparison. We're looking at what response rates we're getting back, we're tracking that and seeing where we've had weaknesses as something where we can target engagement. And also, I would say it's not just particular kinds of providers. So for example, we saw that in Family Friend and Neighbor, and that's something I might ask Adam to speak to is that we put a lot of thought. We had done the P5 had gotten outside funding last year to do a cost study for that we used in our rate and quality work group to make the decision to go to use an alternative methodology. And one thing that we noticed was that family, friend, and neighbor was an area where we needed to do more work around engagement. So I'll turn over in a moment to Adam to talk about what we're doing in that area. But I would also say we rely on the advice of our rate and quality advisory panel. We have a panel of people who come from a diverse variety of perspectives, and they'll let us know. they let us know, for example, that family childcare home education networks was something we aren't being responsive enough to. So we're going to do input sessions and an ad hoc kind of group to sort of think about that model and how we're engaging and getting the information we need. Certain centers have been lifted up as well. I know, I know our Department of Education partners are very interested in preschool, state preschool program, which is a certain funding type program. So then we create sort of ad hoc committees and engagement. But as like a model of what that looks like in engagement, then I might ask Adam, can you talk a little bit about like what we've done to work with P5 this year to ensure engagement around family, friend, and neighbor?
Yeah. Hello, everyone. So Adam Lara, manager with California. But in regards to FFNs, we've been working in collaboration with P5, really to think about how do we partner with local agencies, organizations to organize, host, we're thinking about in-person, but also virtual opportunities to listen, learn, uplift the voices of FFN, the expertise of FFN providers in the design of our equitable policies and systems that we can think about how we meet the needs and strengths of our FFN providers across the state. We recognize the importance of partnership and value the hard work and investment that local agencies and organizations have already been doing to build trust and relationships with FFN providers. And so we are planning to reach out, collaborate with key organizations, agencies that in historically underrepresented, underserved, and marginalized communities to convene these focus groups or input sessions, or we're calling them like roundtables, where we're going to be exploring opportunities in key regions of California, such as the Central Valley, as well as North, but as well in our like Latinx and Black communities in LA County and in Southern California, and then across the state, where we could bring FFN providers together. We were thinking for those that are in person, we could provide lunch, childcare, interpretation, and be able to engage in meaningful participatory conversations and relationship building with the FFN providers themselves. We are co-developing these agendas that are centered around this premise and understanding that FFN providers are the experts and need to play a critical role in helping inform and shape our understanding of and how we design policies and systems that are designed to serve them. And so as we're planning to organize these sessions across the state, we're not looking at these spaces as just to uplift voices and expertise, but to serve as opportunities to also begin developing those relationships with FFN providers and those communities. In other words, the intent is not to create these as one-time events, but it's the beginning of what we're hoping a longer-term relationship moving forward from the state. So we, I think that any questions, but that's a quick update on our engagement with FFNs.
Yeah, so I think that globally, like how I would describe it as like, and this is something we've been working closely with Gina's team on, is it's looking at the data, and then also it's the engagement piece. Like what we can see that areas are missing, then we need to work with our trusted relationships that we, those intermediaries and trusted relationships to try to and develop those relationships to get more information from those places.
Mm-hmm.
And Gina, do you have more thoughts on that? No. Okay. And that, I mean, I'd say the same is true about geographic. Geographic regionality is something that we're thinking a lot about. We have have been talking with sort of experts in this area and thinking about, we can look at a map and at our survey results and see we're missing places, but it's also like, what do those missing places represent? Like how do we think about that, and what the policy implications of that. So both get the data and get the missing pieces, but also think about from a policy perspective, how do we reach and provide an equitable response to, because often what they represent are particularly our overlaps with the places that are farthest from opportunity. It's just hard. It's hard to reach though we work hard. Some of our providers in the rural and far north and eastern parts of our state, Central Valley.
Thanks. I think so. I see, Aaron, you have a question in the chat, and I'm curious if you want to just come off mute and ask your question. I think it relates specifically right around equity and equities of the system.
Yeah, thank you. I kind of spelled out my question there in the chat, but I was just thinking about, talking about cost modeling or true cost of care and how it's implemented. And you look at providers, we have areas. Pennsylvania is a very diverse state, just like California, and we have very high concentrated poverty areas where we have 70, 80, 90%. Low income people who are eligible for our subsidized childcare program. But then we have, more suburban counties or rural counties where a provider may only have a 10% of their total program population may be subsidy eligible. So my question is, how do you address? Are you not creating new inequities in the system for providers that may have they're still serving those low income families, right? They're serving those low income families, but they're not in an acute area, is what I'll say. They're kind of maybe they have 20%, for example, in their low income enrollment. So how does cost modeling fit into that issue?
So there are a couple kinds of things I'm hearing there, and I agree with Gina's general comment. This is a complicated question, and there's not one kind of answer. One thing I'm hearing is this question of whether it just, you say distorts the market or creates inequities in the market, like because because our subsidies don't reach everybody, right? So you could have providers next door to each other and I think it's, you can address, to the extent children are in programs and the subsidies don't reach them, they're, depending on your policies around ability to charge more or less than that rate, there's some ability to use those costs to cover children who aren't, within a program. If a program has no children who are subsidized, then you might have to find other ways to reach them. We certainly in California have other kinds, there's the question of expanding access in terms of eligibility and funding, increased enrollment. And then there's other forms of funding. We have infrastructure grants and other kinds of things that are ways of getting funding into the system to providers. I know in states, there are also, you can have contracted slots. I mean, to some extent, there's going to be finite resources, but and that's true now. But there are certainly there are places that we have as models, also within California as pilots, and there are other states and regions where there's been an ability to use contracted and grant funds to spread payment across programs.
Mm-hmm.
I don't know where it's premature for me to say where we'll land in California, except that we have to say that there are smaller regions already within California. I know in San Francisco and some other places that use some of those variables, as I know they do in DC and some other regions, to try to spread resources across programs, regardless of whether you have a child who's receiving the subsidy.
Yeah, and I think my question was, the reason I was asking was not about the populations that aren't eligible for subsidy. It's about that, in my example, those families that are eligible for subsidy, for example, right? They're looking at a program, 20% of the families are eligible for subsidy. Now, in the other program where it's 90%, you can have benefits, you can have, you can have paid time off, you can have all of these resources. And since 90% of the population is subsidy eligible, it can be spread off. The entire program can benefit. But for those 20% that are in provider, I think it's A in my example, the resources aren't there for those families to benefit from, paid time off, all the fixed costs, all the things we were talking about. So I was more focused on those families that are in a provider that has a lower subsidy population. So that I just wanted to clarify that. But thank you.
Do you mean subsidy eligible or subsidized? Like, are people who are eligible but not reached, or do you mean, I just want to make sure I understand, are people who are not eligible?
So when I'm talking about the percentages in my chat example, I'm talking about like a provider, right? They have 100%, they have a population that they serve. If only 20% of their population is subsidized, right? We call it childcare works here in Pennsylvania. They're in the system, right? We're providing them subsidized childcare. I'm having trouble wrapping my head around how there isn't an inequity created there between provider A and provider B, because provider B is serving a higher a population that more acute. I'm probably not using the right words, but they're serving a higher percentage of low-income families. So they would therefore have that ability to they have more resources based off a cost estimation model to pay for $20 an hour wages, time off, as opposed to provider A, who only has 20% of their population receiving that state cost reimbursement, if that makes sense. I don't know. Maybe I'm confusing it more.
Let me try to reframe that, Erin, and so then you can tell me if I'm correct. So it sounds like your concern is for families that might need to use or are choosing to use a provider with less subsidized children. If you have more resources for those large centers, large number, right? And this is, I think, assuming you raise those rates and it really is meeting a cost and providing the resources providers need. If a parent needs to choose, or their option is a smaller provider with less subsidized children, they may not be getting the same opportunity because their provider doesn't have as many resources from the subsidy system.
Let me put it this way. Provider A, in my example, is still operating 80% of their business is still operating from revenue based on the market, not the cost from that was developed by the state.
Right. So I guess my question would be for California and also for Gina is, do you do any recommendations, or for California, have you thought of beyond rate setting for subsidy? How else might you be using your cost data to inform the larger system to address providers who may not be serving as many subsidized children?
Or in the case of that there's not the subsidy eligible, the threshold needs to be increased. And that's what I was answering in the chat. And that's what New Mexico found, is it's not a single solution to move to rates informed by cost. I mean, if we think about just current cost is current cost. And so we have quite an inequity in the market, the way it functions currently. So we're sort of switching, I guess, where the inequity lies, but we're being more honest about what childcare actually costs, because the providers that are existing only on the market, their cost is higher than what families are paying too. So we're sort of owning what this actually costs, separate from the idea of, say, setting things like far, far higher North Star compensation things, which is a slightly different, the one could argue gets at more of the true cost. In New Mexico, what they found is that part of their approach to addressing this was to raise the eligibility ceiling so that more families qualified for childcare, so that providers in that provider A, if part of your example is what you're saying is there's only 20% of the population is eligible for subsidy currently in the community. So they can't get more kids in their door than that 20%, because that's they're serving everybody that's eligible. But there's other families in their program that if the eligibility ceiling was higher, then could be covered by subsidy. That's a sort of a complementary approach that when we think about the fact that, again, complex problems, single solution isn't going to get us there, right? That's another element of thinking about more solutions.
And dovetailing with what Gina's saying, I mean, and we have currently, I know when I was in the field, we worked very hard, and as a state, we've worked very hard to raise those income eligibilities limits for that reason, because you really want to reach on a scale as much of the market as you can. And CCDF, we're at the CCDF limit right now. That's the Build Back Better that didn't go through. It would be to increase it in our state preschool programs. They have increased it to, I think we're up to 100 and 125% SMI in those programs for that, because of that understanding. And I guess the cost, what's exciting about cost data and about getting this information is that you're identifying the gap. So in your program, my children went to had a variety of kinds of daycare programs. They're now 9 and 13, so they're mostly out of this. But they at least one of the preschools, I think, probably did not have a lot of subsidized children. But if you were looking at the cost, what was the cost of the care that they were receiving there? You would see, based on the tuition being charged and their ability to fill that, like, where's the unmet need? And in some cases, the answer might be, yeah, your income eligibility set up to a fairly middle to higher level, and we had our reaching most of our eligible population, none of which is true right now, but it could be that the private market is providing the cost, is meeting that. Or if it's not, that at the very least, understanding what the cost is would get you closer to it and see what needs to be done to equalize that. So I think of this as information, and then what we do with it has to be guided by, again, our goals. And our goals are not entirely, they're not the market. Ultimately, is our kids getting what they need, our children and families getting what they need. And some families and children are not as far from that as others.
Thank you. I know we're starting to run short of time, so I'm going to transition us specifically to talking about cost modeling, just so we can talk about those data points. And I know I am going to share my screen, and Nina's going to give us a quick overview, and then we just have a few questions for Gina about cost modeling. So let me jump to sharing my screen.
Okay. Thanks, Heather. So we can move to the next slide. We've learned a lot so far in this conversation with California about how they've gathered data from providers and engaged their constituents. And next, we'll learn how they modeled the data. But before we resume the conversation with California, I'll just talk very briefly about a cost modeling tool, the Provider Cost of Quality Calculator. And while pausing to discuss PCQC, we're pausing to discuss this because we want to talk very concretely about the assumptions that you'll need to make when you develop a cost model. So PCQC is an Office of Child Care tool that can help policymakers and providers estimate the annual cost and revenue for a child care home and a child care center. And this next slide is really just the purpose of it is to illustrate where data gathering and cost modeling fit into the cost estimation process. So Gina's spoken to this, California team has alluded to this. This is one piece in the whole process. So you'll gather the data and then use it to develop a cost model. And then you'll use that information to inform policy and funding decisions. You'll communicate what you learn, figure out where you need to improve, do it all over again, all the while engaging providers and partners. PCQC can help you answer questions about how costs change as providers meet more quality indicators or as salaries increase, or many other questions. It also generates a cost per child for each age group in a center. And then on this next slide, I'll just highlight that you'll need to make a series of assumptions when you cost model. So in PCQC, these assumptions are within the categories of classroom information, personnel and non-personnel costs, revenue if you decide to include revenue, and then quality levels. You'll likely create a series of scenarios that are informed by different assumptions, and you'll need to decide what type of care to model and its location. So Anna referenced in California, sort of the coastal areas are very different from the inland areas. So that's something to consider in your cost model. You'll need to decide how many classrooms to include, the ages of the children, the ratios and group sizes that you want to include, and enrollment efficiency. And as Gina said before, PCQC includes some default values, or you can use your own data. And then for the personnel cost assumptions, you'll need to make decisions about what to include for salaries, benefits, and other personnel costs. And then the non-personnel in PCQC include a lot of default values, and they're divided by per child, per classroom, and per site costs. And then if you include revenue in your cost model, you'll need to make a based on data about funding sources, subsidy and tuition rates, and uncollected revenue. And then you'll also need to think about the cost of higher quality levels. So this slide shows that cost will likely change as quality improves. And then I'll just end with a quick note that PCQC generates an expense and revenue statement and a cost per child for each age group in a center and an average cost per child in a family child care home that you can then use to inform your rate setting or other funding decisions that you want to make. And Heather, I'll turn it back over to you.
Great. Thanks, Nina. So my question for Gina and for California is how do you that's a bit of an overview of all the different things could fall into a cost model. And you did describe how you're doing a survey, but also then building a model. And so can you tell us a little bit about those assumptions and how you kind of go about taking that data and turning it into a cost model?
Gina, do you want to take a stab at this?
Yeah, sure. I will jump in. So the elements of functioning cost modeling that Nina outlined sort of apply no matter where your cost model efforts take place. And so part of the process that we use with states in doing alternative methodology is building them their own cost model tool. So we have to have all of those elements that Nina just walked through. We want to tie into those elements as much as possible, and where the analysis from the data collection can support us in this is some of how the assumptions are driven or how they're based. And so we are looking to analyze certain kind of core themes or threads out of the data. And as Becky mentioned at the outset, sort of talking about what the alternative methodology guidance or regulations from the Office of Child Care cover, it covers things like understanding the care and cost of care provided to different ages of children in different types of settings. So family child care, center-based, FFN, in different geographic regions of the state. The possibility is even the sort of term of the care. Like, we typically are looking at full day, full year because we're talking about the subsidy rate system, but we also could be looking at part day, full year, part day, part year, right? So you have to like take into consideration all of the program implementation variables that come with the differences across childcare programs. In states, another core feature of this is typically understanding the difference between programs that are meeting licensing and programs that are meeting higher program or quality standards, whether it's a quality rating and improvement frame that the state has, or whether it's a contracting approach and there's different program standards to those to meet the contract versus just meeting licensing, right? All of those things are cost drivers. That is all information that is also able to be gathered through surveying, and we can analyze the cost based on different variables. If they're funded by only the voucher or the subsidy system, or if they're funded by a contract and they're held to higher regs. What do we see as far as the sort of in the analysis? And that's the effort that we're engaging in to then think about how we use the data, pulling it into the cost model. And so I'm going to share one last time before we all are done this afternoon, but I just want to share one that sort of like lays it out, how the data gets used. It's used in multiple ways. You see that right there at the top of the slide. And I know I've said that multiple times, that the data is used in multiple ways depending on what the data is, but particularly program and provider data is going to be analyzed to support some of those baseline assumptions. So how do we know that what are the costs related to programs, regardless of their program type, the ages of the children they're serving, all of those variables that I just mentioned, what is their cost related to meeting licensing? And then we start to understand, okay, what are their costs related to meeting other regulations? And when we analyze that, then we have to take that combined with some of the extant sources and some of the other contextual factors that are really important in a given state to determine, okay, then what is going to be that assumption in the cost model? It's not necessarily a direct comparison that we got from this group of providers that we collected data from. This is it. This is the only possible cost to meet licensing, right? It's not that clean and clear. There is a lot more additional context that comes into play, but that's that process, is, as Anna alluded to, the rate and quality panel and other constituents giving input in helping to make sure that the assumptions that get made and how the model functions are really strong and can be really vetted against the reality of being a provider in your state. We also have the opportunity to build in multiple selection points in the cost model. So the data helps us with that. We may find that there are actually 3 different costs related to that we see kind of across the data. It's really trending that we see these 3 different costs related to meeting X. Well, those can be selection points then in the cost model. The state can then say, okay, are we going to go sort of middle of the road for the cost on meeting that standard? Like if it's, say, meeting the training standard within licensing standards, the state can make that selection point. So we don't end up with a model that only has one answer to the question. Usually we actually give states more options because the data has given us the kind of, it depends with the answers that we got. There's not a single answer, but we are finding that here is the most common 3 or 4 answers. And that can help the state then understand, based on either different parts of the state, the regional variation may be the reason that there's a difference in the cost, or it may be other factors of program implementation that may be the difference. And so we can build some of that in, but analyzing the data with that in mind is that how do we create those multiple selection points that allow the state to sort of understand some of those things. And in particular, as California has been really focused on having this be an equity driven process, that we're also really thinking about how do we make sure that there's selection points that don't just embed the current inequities, but actually support them and remediating some of those inequities. And so the data is helping us with that too, because there's an element of sort of, this is what's currently happening related to, say, serving a child with special needs. Is that the reality of what we want for those providers? Do we want to pay that forward, or do we actually want to break that cycle that they don't have the resources they need to buy the specialized equipment? And that's some of how the cost model can be a resource that is thinking about the future and remediating those inequities.
Great, thanks. So do we have, I'm going to open it up to any questions because we are getting closer to the end of our time. related to any part of what we've talked about in collecting cost data. And while we're waiting, I actually do want to kind of circle back to a question I didn't get to ask because we didn't have the time. And that is, can you, Anna or Adam or Becky, give a little bit more information? It sounds like you really are focused on gathering information from providers and developing your relationships with providers. Who else do you engage in this process? And can you give us a little bit of an overview of how you're doing that?
Yeah, glad to. So there are a couple kinds of ways I would interpret that question. We have the rate and quality advisory panel, and I'll talk about them in a moment. But we also have consultants to the process, additional sort of external consultants around some of our equity and other questions, Child Care Law Center and Child Trends, who we've worked with to, because one of the sort of things that has come out of our rate reform process as important is an ongoing analysis of our process for equity to see if like there are considerations we're not taking into account. And also once we're done, you're never really done because there'll be the next state plan process and this all over again, what things we might have to change in the future to address unintended consequences, for example. But then more formally, we have, I would say California has a very robust system of engagement. We have monthly contractor meetings with our 460 plus contractors. We have our ECPC, and now I have to remember it's Early Care.
Early Childhood Policy Council.
Thank you, Becky. We have a lot of alphabet soup. Which is a governor-appointed council of early care and education experts representing a variety of perspectives, from families to different provider types, and other childcare experts and early learning experts who advise. Have a state mandate in ongoing meetings to advise to create our plan and keep us integral with our plan for early learning. And there are sub work groups of that that include workforce and parent work groups. And so we have been vetting this process through that, presenting it, keeping everybody updated. So those are sort of our existing constituent engagement meetings. Which are robust. And then we have, but then we specifically convened for purposes of this alternative methodology process, a rate and quality advisory panel. And that came out of, because things are fairly messy in California, we have long recognized the need for rate and quality reform around, particularly with our multiple rate systems, our flat standard reimbursement rate, regional market rate. There are longstanding rate reform efforts that go back at least to the early aughts. And they took a really more formalized turn with the passage of a bill called AB 131 in 21-22 that established a rate and quality work group to come up with recommendations. One of those recommendations was for rate reform. And one of them was to move to an alternative methodology process. And it created, with our newly at that time formed labor union, the Child Care Providers Union, a joint labor management committee that presented formalized recommendations to the legislature, to the Department of Finance and the governor for inclusion in the budget. So those recommendations were given last year and we've moved forward, and we're not currently walking, but because we already had these people who have been thinking, carefully selected this wide variety of diverse constituents, and have been thinking intensely about these issues and published this 100-page report, it seems silly not to build on those efforts. And that's actually now formalized in some of the legislation in the budget this year is formalized that we're building on those recommendations, which which address some of those kinds of decision points and data points and state value sort of issues in thinking about the cost modeling and rate setting that Gina touched on. But there's still a lot of work to do. But we reconvened those work group members as a rate and quality advisory panel, and we've been meeting with them every other month as part of this process. And presenting where we are on that sort of, when Gina went over the general model of like there's the data gathering and then cost modeling, we sort of have covered the stages and where we are, and we're presenting information to them to get advice. The decision making will ultimately happen because of our bargaining agreements, et cetera, by the administration and the union and the legislature. But the advice all along at every point is just profoundly important because there are so many decisions that have to be made. I mean, I cannot overstress that you gather data, but then what you do with the data and all those policy decisions is something that is going to be instructed by choices and values.
And I'll mention too, real quick, on the relationships we have with our tribes. California has has 109 federally recognized tribes. We make up 12% of the national total of Native American population. So through two different means, we meet with them regularly too. The Department of Social Services has the Office of Tribal Affairs, and they're charged with, the responsibility of building better government-to-government relationships. So we participate in quarterly meetings with the Office of Tribal Affairs here in the department. We also have a close relationship with the professional association, the Tribal Child Care Association of California. And as a matter of fact, Gina is going to be joining us next week at one of their quarterly roundtable discussions, where we'll be presenting, the opportunity to take part in these surveys. So we have a close relationship with those monthly meetings with TCCAC and quarterly meetings. So don't want to forget them.
No, thank you. It's very important. And in general, as part of our state plan development process.
I could keep asking questions, but I see that Aaron, you have your hand up. Do you want to go ahead and ask your question?
Yeah, thank you. Sorry, I hope I'm not badgering with too many questions. But I did have a question, and if there's not an answer, that's okay. When California transitioned from a market-based approach, right, an MRS approach, to a cost modeling approach, was there, I assume there was an increase in the cost per enrollment is what the term I'll use, but you guys may use a different term. What was there a percentage increase? And I'm talking generally at not a specific care level. And the second part of my question is, in addition to what was the increase, the percentage is fine. Did that impact your ability? In Pennsylvania, we have had to deal with waitlist in the past, trying to within, our appropriation authority and all that. So I was just thinking that two-part question. Thanks.
Yeah. So to be really clear, first, we haven't transitioned yet. These are decisions we're going to have to make. Where we are in this process is we've submitted our alternative methodology plan. It's now been approved. We're in data collection right now. And then in the fall, winter, we'll be doing cost modeling. And then the plan is in the early spring, like by February 15th, to come up with a rate structure and basic base elements. And then we'll be rate setting and making some of these decisions in the summer. It's premature. We are very cognizant of that, and I know that part of thinking about it, I will say, is there might need to be a transition period. I mean, that this goes to not in terms of moving to the rate, but like how do we implement it? What percentage of the cost rate, or we don't know. I mean, we can't decide on our own, but I know that I can say, I think this is where ongoing engagement too with the union, the Department of Education, families, legislature is like, everybody needs to be very clear on that and to understand the costs and some of the trade-offs as part of that process. I have heard even union representatives, though, say in legislative hearings that there might need to be a transition period to the full cost. So I don't know how that will look. But it is something that we are thinking about.
Thank you. And I realize we are actually out of time, so I'm going to do just a really quick close out. And I want to thank Anna, Adam, Becky, Gina, Nina, and everybody who came and participated. This has been fantastic. Like I said, I could really keep asking questions. We had planned questions that I wasn't even able to get to. So this has been fantastic. Thank you. So our next session will be on, in this series, will be September 14th. We're likely going to talk about analyzing the data. This was about data collection. And the next step would be about analyzing the data and thinking about the data after you have it. And I also want to just remind everyone that you can ask for technical assistance at any time. So as you're thinking about these questions, or maybe you want to explore using cost data or any of these types of questions, technical assistance is available to you. You can talk to your regional office, or you can submit a request through the technical request form for technical assistance for your state or territory. And I want to thank everybody for coming and remind you that we do have an evaluation. We do look at those results. We absolutely take what your suggestions and your questions. So please complete the evaluation. Let us know what you think. And if you have topics, or if there was a question, something we just touched on here, and you want us to expand on it more, let us know as we develop this series. And thank you, everyone. Have a great day.
Bye, everyone.